My name is Alison Schofield and I've been the lead governor for the Council of Governors for the last year, and I was elected to the role in July last year. One of the things we were keen to do was to make it more visible who the governors are and that they represent their communities as volunteers. So on both hospital sites, so that patients and members of the trust can see, we've got posters up. So in my year as a lead governor, my focus has been more around patients from more vulnerable groups who access the trust. I was involved in the panel, which made up of staff and architects and estates managers, around transforming the toilets at Huddersfield Royal Infirmary for outpatients. So we talked about sort of the layout of the toilets and what would help people the best to be able to access them. And we also did the yellow signage, which is helpful for people with visual impairments or learning difficulties, because it's a high contrast, they could understand it better, and became more up to date with the Equality Act by using accessible instead of disabled on the toilet door signs. Then I've also been involved in wheelchair service procurement with the CCG. So it's been a busy year for the Council of Governors, and we've enjoyed working with the new chair, Philip Lua, in his first year. He's done really well at getting to know the governors and us getting to know him. So there's a lot of areas that the governors have been involved in during the year. They meet with divisions to understand about their complaints and how they improve their services. So they look at how they're managing their performance, the money, the staff, and also how they're improving the care and the patient experience. We've had a number of workshops with our team of non-executive directors to talk about the future plans of the trust. In May, both me and Brian Moore attended the Governor Focus Conference in London, which was governors from all over the UK came to the conference to find out what the NHS expects of governors. Also this year, two non-executive directors, their 3-year tenure has come to an end, Richard Hopkin and Karen Heaton, and we decided to extend them for a further 3 years. So we've acknowledged their hard work, and we look forward to working further with them over the next 3 years. So the governors have attended a number of training sessions to help them be more confident in their voluntary role and to understand how the NHS Trust works. And on behalf of all the governors, I'd like to thank all the staff in the Trust for their hard work over the year. I'd like to thank all the governors who are leaving this time for their contribution to the council and giving up their hard-earned free time. And also like to welcome the new governors who are joining the council. So I'd also like to thank the team that supports the governors, particularly Vanessa Henderson and Amber Fox, for all their support. Cheers.